Hi, I'm Dr. Peter White, and these are instructions after tonsillectomy. There are several important issues to consider when recovering from your tonsillectomy. Issue number one is that the most common, more serious problem we have is bleeding. It's relatively unusual to bleed at the time of surgery. The most common time to have bleeding issues would be 5 to 10 days after the procedure, but they can occur anytime within 2 weeks of the procedure. Taking any kind of medication that might thin your blood might encourage this to happen. So under no circumstances should you take any aspirin, and even non-steroidal anti-inflammatory drugs like Advil or Nuprin or Aleve can thin your blood, and they should not be taken for pain. Children in general are given Tylenol for pain, and older children and adults are giving stronger pain medication, which you would have been given on the day of surgery. And these are safe and will not contribute to any bleeding issues. The chance of that occurring is small, but it does occur, and you just should be prepared to call the office, call the emergency room if this does occur at all. Issue number two is pain control. It's not possible to have your tonsils out and not have some degree of discomfort afterwards. The children tend to do relatively well compared to the adults. You will be given pain medication at the time of the surgery, which should get you through for the first several hours after the operation. Children in general do fairly well with Tylenol, and for children who are experiencing extra discomfort, you should call the office and we'll make some recommendations to bring that discomfort under control. Adults usually receive a prescription for a narcotic pain reliever and also perhaps some steroids to try and limit the amount of discomfort afterwards. Typically, young children have discomfort for about 5 or 6 days, but adults may have ongoing, quite significant discomfort for 10 or 11 days. It's very typical that 2 weeks after the operation, when you yawn or open your mouth very wide, you still have some discomfort, and that fades away with time. From the surgery center, you should receive a sheet of information about post-operative diet. This can be progressed as you see fit, but all patients should be on a soft diet for about a 14-day period. Again, this helps to limit bleeding after the procedure. If you have questions, please contact us through the office at 373-3070. If you have an emergency, 333-5000, and we'd be happy to help. Thank you.